Hello Africa, you're live on another episode of Ladyz Digest, where issues in the world of women are discussed. And as usual, I'm your host, Joan Akua Iyoha. And the show is proudly brought to you by the AAU TV, the voice of higher education in Africa. For some episodes now, we've been discussing uterine fibroids. We talked about the symptoms, we talked about the causes, and we talked about some treatments that can be used to cater for this condition. And this is the concluding episode, and we'll also be dwelling on the treatments. Do catch up on our social media handles on Facebook and YouTube at the Association of African Universities and our Instagram page at Ladyz Digest. Do stay tuned. Dr. Udele Tagoe is a general gynecologist and minimally invasive gynecologic surgeon. She is married with 4 children. She is very passionate about delivering quality, compassionate care to women. And her hobbies are running and reading. Welcome back, and we have in our midst our regular gynae, Dr. Udele Tagoe, and we are in an office still. Thank you, Doc. As I always say, thank you for inviting us and squeezing
You're very welcome
to attend to us. So in our previous episodes, we've been looking at, you introduced the uterine fibroids. We defined it in a very lay term, and you talked about the symptoms, the causes, and in the next episode, we talked about the treatments, some forms of treatment, diagnosis, and treatments. And we'll conclude this episode, a very, very vital topic. And we'll still be dwelling on treatment.
Okay.
So I want to know, is there any way of removing, or what are the different ways of removing these fibroids?
Right. With fibroid removal, there are different modalities or different ways to remove them. Okay. In considering which way to choose, there are many factors we look at. So firstly, it's what is the woman's wish for surgery. Okay. If it is for fertility reasons, that plays a role in the choice of removal, the way the fibroids are removed. The location and the number of fibroids also plays a significant role. And then finally, the size of the fibroids, that also plays a significant role in the choice. Before I go into more detail, I do want to say a little bit about minimally invasive surgery. Okay. As you introduced me, I am a minimally invasive gynecologic surgeon. So minimally invasive surgery is also known most commonly as keyhole surgery. Keyhole surgery. So it's like the hole of the key is very small. That's why it's termed that way. And keyhole surgery is also known as laparoscopic surgery. So a laparoscope is a special camera that is inserted into a body cavity to visualize the contents therein. Okay. And so when it comes to fibroid surgery, the minimally invasive approach is a possibility, laparoscopic approach. There are also other forms of minimally invasive surgery that includes vaginal surgery, which means that the entire procedure is done through the vagina without any cuts on the abdomen at all. And there's also hysteroscopy. So the prefix hyst, H-Y-S-T, refers to the uterus. It's just an old Latin, Greek. Don't quote me on Latin and Greek. I took Latin long ago. But it's that prefix hyst, H-Y-S-T, refers to the uterus or the womb, okay? So hysteroscopy is a way to take a narrow camera, insert it into the uterus to visualize the contents inside the uterus. Like I mentioned earlier, sometimes fibroids can be located exclusively on the inner cavity of the uterus where a baby would grow. So in those cases, that is where hysteroscopic removal can be employed, okay? It's just a different form of minimally invasive surgery. In that case, it's very important to know primarily what the woman's symptoms are and also confirm that the fibroid or fibroids are located within the cavity of the uterus. Additionally, there are different categories of fibroids that are located within the uterus. So what I mean by that is that sometimes you'll have the case where the fibroid is completely within the uterine cavity, and we'll have pictures which demonstrate this as well. So the entire fibroid is completely within the uterine cavity, almost in the same way you'd see a baby attached to the inner wall of the uterus, okay? That's a type 0 fibroid. But then there's also the case where sometimes part of it is inside, part of it is within the muscle wall. So it's important to know what category the fibroid is, if it's a fibroid that's completely within or partially within the uterine cavity, to know whether or not the hysteroscopic approach is the best approach. If most of the fibroid is in the uterine wall, like the muscle of the uterus, and only a small portion is within the uterine cavity, then in that case, sometimes the hysteroscopic approach is not the best approach. So that's going into a little bit more detail, but again, it's just to highlight that knowing the specific details of where the fibroids are located, what the symptoms are, what the woman's desires are, what is the main reason that you're removing the fibroids, that is what goes into play in terms of determining the approach. So that's on the minimally invasive side. Then you have traditional open fibroid removal. And again, I don't know if I mentioned it, fibroid removal where you leave the uterus in, you only take the fibroids out, is called myomectomy, okay? So you have traditional open myomectomy. Open means you just make your traditional open incision on the abdomen. The same way a C-section or CS cut would be made, it's that same incision. Depending on the size and the number of the fibroids, sometimes the incision is made across the lower part of the abdomen, very similar to a CS. But then sometimes, depending on the size and the quantity of the fibroids, the number of fibroids, sometimes you need to make the incision up and down. The choice is usually determined on what the surgeon thinks is most feasible to be able to do the surgery safely and have a positive outcome, okay? In general, when a woman has many fibroids and the fibroids are very large, it can be the case that a minimally invasive approach may not be the safest approach or the most prudent approach. When a fibroid is removed from the uterus, you can take out many, sometimes up to 20 fibroids can be removed. But now, what has to happen is, once you've cut the uterus to take the fibroids out, you have to close the uterus back up. And we close it back up by sewing it, okay? So if you can imagine, if you have something and you have your two hands in and you can hold the tissue and sew it together, almost very similar to how you would sew a garment together, you know, you have both your hands, you have a little bit more control in terms of ensuring that you've closed the uterus properly. When it comes to laparoscopic surgery, laparoscopic myomectomy, where you have instruments. So now I have small cuts, and again, a picture will show this so the women can have, or whoever's watching. I know women and men you can watch as well.
Yeah, you're allowed to watch.
You're allowed to watch. So in this case, your hands are not in the abdomen. Rather, you have special instruments going through a special sleeve through those small incisions that are actually making the cuts to remove the uterus and remove the fibroids. And then you are taking your suture or your thread, so to speak, and then sewing the uterus back together with your special instruments, okay? So in that case, you need special training and a certain level of experience to be able to do that well. This is especially the case when you're considering women who want to conceive in the future. And in fact, that's the main reason for doing a myomectomy and leaving the uterus in place, is because you're trying to preserve or save the uterus for future fertility. And so if you don't close the uterus properly, then what happens is you will have some gaps where the incisions were made, where the fibroids were moved, and blood can collect in there. And then in the future, even after the woman heals, that portion of the uterus where the cuts were made always remains a weak point on the uterus. So if you can imagine, when a woman conceives and then goes into labor, the uterus contracts. Very, very strong forces to contract in order to allow the baby to deliver. Those cuts on the womb always are a weak point, okay? So there is a risk after having myomectomy done of having what's called a uterine rupture, meaning the incisions can break open during the labor, and then that can be disastrous for the woman and for the baby that's trying to deliver. It can be very, very serious. And so myomectomy and closure of the incisions or the cuts on the uterus is very, very important in terms of, the future pregnancy. So when you're talking about laparoscopic surgery, minimally invasive surgery, you want to make sure that you are choosing the appropriate candidate. The woman's condition, meaning the number of fibroids, the size of the fibroids, should be such that there's an increased likelihood that you'll be able to close the uterus properly. So with that being said, when there are many, many fibroids, like 20 fibroids, laparoscopic approach is not the wisest choice. Additionally, if the fibroids are very huge, such that a woman may seem like they're 6, 7, 8 months pregnant, which can be the case sometimes a laparoscopic approach is not feasible. So minimally invasive surgery, laparoscopy, hysteroscopy has many benefits in terms of decreased blood loss, faster recovery, less risk of infection. However, you have to choose the women for that type of surgery very, very carefully. And so if there are many fibroids, the fibroids are too large, or especially if a woman has never had children before and they fall into that category where they have many or large fibroids, it may not be the case that the minimally invasive approach is the best, because you want to make sure that you do as good a closure of the uterus as possible. The other piece to really consider in terms of the approach also is, what is the woman's prior surgical history also? It's frequently the case that women, especially if they've had fibroids at a younger age, let's say 20 or 30, and let's say they've had a prior removal, or even if they haven't, let's say they had prior CSs, sometimes they may grow fibroids again. And so you're looking at doing surgery again. So there are certain evaluations that we also do to assess, okay, what is the likelihood of scar tissue being present in the abdomen? If there's a high likelihood that we suspect a lot of scar tissue in the abdomen or the pelvis, then that also will influence which choice of removal will then be utilized.
Okay. In the course of what you said, you mentioned fibroids reoccurring, so there's a possibility of fibroids recurring.
Absolutely, and I'm glad you asked that question. That's a very important point that we should discuss. The younger a woman is when she develops fibroids, the more likely it is that she will grow new fibroids in the future. So I see many women who present in their 20s or 30s and they have fibroids which are causing symptoms that warrant surgical removal. So we'll go ahead and remove them. But remember what I mentioned as the main factors that contribute to fibroid growth. Hormonal stimulation. So as long as you are menstruating, meaning you're still producing your female hormones, you can likely grow fibroids again, because fibroids grow in response to our main female hormone, which is estrogen. So fibroids can grow at any point from the time you start your menses until menopause, when you stop your menses. It's very rare that fibroids will grow after you have your menses, because you're not producing the hormones anymore. That's why you've gone into menopause, because the hormonal production has stopped. And so yes, it is the case that the earlier in life it is that you develop fibroids and or have to have surgery for it, it is a high likelihood that you will develop fibroids again. Yes.
We'll go for our tipsy one.
Sure.
This is still Ladyz Digest. Stay tuned for tipsy one.
Hello there, welcome to Tips in One segment on Ladyz Digest. Today we are talking about uterine fibroid. According to the World Health Organization, fibroid is extremely common. The report states as many as 80% of African American women and 70% of Caucasian, Hispanic and Asian women develop uterine fibroids by the time they are 50. Doctors don't really know the cause of uterine fibroid, but research and clinical point out genetic changes, hormones, extracellular matrix, and other growth factors as major causes. Symptoms include heavy menstrual bleeding, menstrual periods lasting more than 1 week, frequent urination, constipation, back pain, and leg pain. Seek medical attention immediately you notice any of these symptoms. Preventing uterine fibroids may not be possible, but it's only a small percentage of these tumors require treatment. But by making healthy lifestyle choices such as maintaining a normal weight and eating fruits and vegetables, you may be able to decrease your fibroid risk. Enjoy the rest of the program.
In case you just joined us, this is Ladyz Digest with your host Joan Akua Iyoha, and we are in the office of our regular gynae, Dr. Udele Tagoe of the Lucca Health Medical Specialty Center. Welcome, Doc.
Thank you.
And we're almost rounding up.
Yes.
And I know in the introduction of this topic, you made mention that fibroids are benign tumors. And I tend to think, just the way HPV, I know we treated HPV some time ago, just the way HPV, when left untreated, can be cancerous.
Yes.
Would you say that fibroids can also be cancerous when left untreated? Though you say some people can decide to leave it untreated.
It is true that fibroids can become cancerous.
Okay. Wow.
However, the chance is extremely low.
Okay.
So cancer in any muscle tissue is called leiomyosarcoma. Okay?
Sure.
Leiomyosarcoma, LMS. Let's say LMS. So leiomyoma, that's a different terminology for fibroids. So the sarcoma portion is where it talks about malignant or cancerous change of uterine fibroids. The incidence of leiomyosarcoma is very, very low. Less than 1%. Okay, it's been studied quite extensively, especially because obviously when you are removing fibroids, you want to make sure you're not leaving any tissue behind that could be cancerous. In general, the risk of leiomyosarcoma is somewhere around 0.2% when you talk about women who are under age 50. So this has been studied, and most studies have shown that, for example, to put it in more appreciable terms, if you take 100 women and they have fibroids removed, the likelihood that cancer will be found in the fibroid that is removed is essentially zero, or less than one of a woman. Now, all women are whole women, so essentially it's close to zero. Okay? Now, when you look at women who are over age 50, that's when the chances of leiomyosarcoma being found is a little bit higher. Only a little bit higher. So around 1.2%. So even then, if you take 100 women over age 50, they've had fibroids removed, you look, you do a microscopic analysis and see what is the chance of finding a cancer in the fibroids. One woman out of the 100 may be found to have cancer. And that is just because, in general, cancers throughout the body, for the most part, the likelihood of cancer developing tends to increase with age. Okay? So most women can be reassured that the likelihood of their fibroids transforming into anything cancerous is extremely low. However, as a woman gets older, especially above age 50, and then presents with symptoms related to fibroids, there are certain additional tests that I would do to ensure that there's not a likelihood of finding cancer there. So there would be more than just the usual blood tests or the ultrasound or pelvic exam that I would do. I would order additional imaging testing like MRI, because there may be certain features that can be picked up on MRI, which is magnetic resonance imaging. It's just a different way to take a picture of any body cavity, in this case, the pelvis and the uterus. Sometimes there are some findings there that might be suggestive. Additionally, I might actually do a biopsy, an actual tissue sample of the cells from within the womb.
Okay.
In that way, I can also try and reassure myself to know that, okay, well, the likelihood of this fibroid being cancerous might be on the lower side, you see. The other thing that is important when considering the likelihood of leiomyosarcoma is that, you know, when a woman comes in and she's older than age 50, chances are she's done with childbearing,
Sure.
you see. And so if that is the case and she's having symptomatic uterine fibroids, that's where I introduce the discussion and maybe encourage. I never push.
Yeah.
No one should feel uncomfortable with whatever, you know, choice they have. They should feel comfortable with what they choose. But I usually would say, okay, if you are not going to preserve your uterus for the purpose of fertility, then really, if you're going to undergo surgery for the fibroids, it may be worthwhile to remove the uterus altogether.
Yeah.
So usually in that way, you can remove not only the fibroids, but the entire source of the fibroids, which is the womb.
And no more tendencies of it reoccurring.
And no more risk of the fibroid possibly converting into uterine cancer. So that's very important. One other thing I want to mention, you did mention HPV, human papillomavirus. We talked long ago about HPV.
We used some 3 episodes.
Exactly. High-risk human papillomavirus we know to be the cause of cervical cancer, the cervix being the opening to the womb. HPV is not related to uterine fibroids at all. I just wanted to clarify that. So we just use it as an example to, you know, question whether or not fibroids can undergo cancerous transformation. But HPV is strictly related to the development of cervical cancer, but not to the development of uterine fibroids. Yes, at least not that we know of thus far. Yes.
Yeah. All right, thank you, Doc.
You're welcome.
Always making yourself available for availing yourself whenever we ask for your knowledge. Any last words for our viewers?
My final words are always the same, as you see. Please, if you ever have any concerning findings, you know, you may hear certain things that you may want to inquire about in terms of symptoms you are having or even a family member is having, feel encouraged to come and visit a gynecologist. It's always important, and I like to empower women as much as possible to be aware of your own body, what's going on, and also to be encouraged to ask questions about your body and any symptoms you may be having. Most of the time, everything is fine. That's the good news. So coming to the gynecologist shouldn't always invoke fear or worry. Most of the time, everything is fine, but it's very important for us as women to take charge of our own health, and part of that includes coming to see your gynecologist. So those would be my final words.
Yeah, thank you very much.
You're welcome.
As Dr. Udele said, it's very important that we ladies take charge of our health and our personal health. This has been Ladyz Digest, and it's been a great journey talking about uterine fibroids. And many thanks to my production team for making all these shows successful. You can always catch up on our social media pages on Association of African Universities and our Instagram page at Ladyz Digest. So we'll come your way with another topic. Stay tuned.